Greetings and welcome to Infusing Social Justice during the COVID-19 crisis. I'm your host, Brian Medina. My pronouns are Z, here, here's, and hereself. I work at the University of Maryland College Park as the new Program Manager of Bias Incident Support Services. Effectively, my main responsibilities are to respond and assist students or staff or faculty who experience bias or hate on and off campus. I also advise the hate bias response team that we meet monthly to discuss cases and situations and protocols we can improve. I also oversee and manage the hate bias response team's student advisory group, a group of about a dozen students who then inform best practices from their perspective on how to best assure marginalized populations on campus are supported. Thank you for joining us today. We are clearly experiencing an unprecedented time. And while we throw that word very flippantly at times, unprecedented is probably the best word we can come up with based on the circumstances because of the tragedy, uncertainty we are experiencing. And not just we individually, but we collectively as a society and as a world. And so it's important to name it and call it for what it is, unprecedented and tragic. I will share many details. I won't go into great depth, but I will share details that could be triggering for some audience members. And so I do recommend that if you do get triggered by anything I do share during this recorded session, I recommend that you either pause or close out of the session, and please take care of yourself in the midst of this. It's an important resource for you to have, but it also is important for you to maintain your own boundaries and self-care in the midst of attending and educating yourself on this information. It also is important to call into question the impact that we have might be varied. And so the impact on COVID-19 based on your health, based on the family members that may or may not be impacted in your surroundings, based on your location. For folks within this region that are in New Jersey or in Pennsylvania, clearly have a different outlook on this than others within West Virginia, Delaware, and Maryland. And even those near major cities or those that have connections directly to this crisis. And for those many fortunate not to have a direct connection, you also may have varied impact depending on if you have family, depending if you have to take care of an older loved one, an older family member, if you have kids, if you have pets, if you have your own health conditions and challenges that prohibit you from going out even when you are permitted to for groceries, etc. If your economic status is impacted because of potentially questions about furloughs at the job, or your staff pressures or mental health challenges. We'll go through some of this, but I just wanted to make sure up front that the impact on each of us is varied. And so it's important for us to, as we communicate with one another, as we check in with one another, that we understand that we may be coming into even different days may look different for each other. Different news and tragedies come day by day. And so we want to be compassionate, supportive in response to this. Also acknowledging that we are fortunate. Those that are listening to this are fortunate. We are alive and well in the circumstances. I want to start by doing breathing and grounding exercises. And by that, breathing is a very straightforward exercise, and that is counting to 3, breathing in, counting to 3, and breathing out. It's something that we do often within crisis and trauma work, largely for folks as they try to center and trying to de-escalate stress, to try and make sure that their heart rate is lowered. And so let's do that now briefly. Counting to 3. 1, 2, 3, take a deep breath in. 1, 2, 3. Deep breath out. If we were to do that for about 30 seconds or whatever it is that you need at this time, 30 seconds, a minute, maybe 2 minutes, taking concentrated, focused breathing is very important for self-care. Likewise, grounding exercises through trauma-informed support can be about identifying your surroundings. If you're privileged enough with sight, then identifying and seeing what is around you and calling it for what it is. So maybe it's a computer, it's a desk, it's a lamp, it's a bed, it's a whatever it is in your surroundings. Say it out loud. Use the grounding exercise as a means for you to be centered and present in the moment. So whether it's seeing, using that sense, if you have that sense, hearing, if you can hear friends in the distance, if you hear music in the background, maybe if it's nice outside, birds chirping, whatever you hear, identify that, call it for what it is, gives you the opportunity to be in the presence. Also, any other senses that you may be able to use. So whether it's smell, hopefully good smells, you smell maybe, I love lavender, and so maybe having some lavender or some other kind of scented oils or candles safely in your surroundings. Maybe it's also the sense of touch. And so if you have a favorite blanket or a pillow or some other maybe clothing article that you really appreciate and just need to bundle up if you're cold, the temperature, etc., feeling in that way, the touch is very important. And while it's not common for you to, in the midst of this, you using your taste, for you to have privilege of taste, if you're having a snack or using or having a drink, then just even describing what that is and identifying, you really enjoy that coffee or that water or that snack that you've been able to use. Identifying all these things in the moment can be a very powerful opportunity for folks to be grounded in the moment, and the breathing exercises going along with that to ensure that you are the most centered and calibrated the best that you need. So throughout this presentation, I'll be talking about different isms and different issues that folks are encountering. These are not exhaustive, but I wanted to start off with what is around us, and this is both on and offline. So xenophobia, by that particularly I mean the naming of COVID-19. The reason that the name is important, we're naming a medical term, something that was approved by the health community, by world leaders, that COVID-19 is actually is just a shortening of coronavirus disease 2019. So for folks that are confused or maybe haven't heard that, that is just a shortening of coronavirus disease 2019, because that was when it was discovered at the end of December, and obviously we're experiencing that in 2020. To call it Wuhan or Chinese virus is xenophobic, is racist, is not only inaccurate, it certainly also puts into play where somebody's looking at country of origin as an entire totality for a people group, and that is not right. It's not just, it needs to be called into question whenever you see it or hear it. And so even though some folks have made the comparison to the Spanish flu, it's actually not, it's a misnomer. Spanish flu actually didn't derive in Spain. You can certainly look it up, that there are disputed accounts. They're actually unsure exactly where the origins were of the flu pandemic of 1918, about 100 years ago. And so for us to be claiming something as comparable to another pandemic, this is actually not a flu, but another pandemic, is not appropriate, it's not accurate. And then calling something by a people group is also not. So using terminology that's accurate, COVID-19 is the word, is the name. If you want to use coronavirus, because coronavirus is a broader umbrella term to describe all types of coronaviruses, COVID-19 is a specific one that we are experiencing at this time. We're also experiencing ageism in our society, and so many vulnerable populations in assisted living homes or nursing facilities, folks that may have compromised immune system that are aged already, maybe have comorbidities. By that I mean other things like asthma or breathing challenges or diabetes, other things that coupled with that are often seen for those older generations. But it's important for us to call that into question as well, because it also, this virus does not discriminate based on race, age, gender, what have you. It is can be deadly and certainly has symptoms for many people, not just those that are elderly. And so for folks that are in older generations, there are also some that survive this and thrive through this, others who do not. Certainly a higher percentage that do not as compared to other generations and other age groups. But there are also many kids, more and more in the news. We're seeing kids and teenagers, those that are in the age group that we generally work with, 18 to 22 or beyond, that are being affected by this and dying by the virus. And so it's important for us to call into question ageism in the midst of information that we're sharing with one another and identifying with one another, and to call into question politicians or other leaders who are favoring economic interests over the elderly. And so I've heard several, I won't name them, but several individuals who have stated how it's so important for folks to go back to work, that our economy is hurting, but some folks that are older can sacrifice for the younger generations. And that's clearly ageist, that's clearly concerning. If they themselves want to sacrifice, that's one thing, but it's not okay for us to sacrifice others as a means for us to say that the economy needs to improve, and so we can sacrifice some of those in our populations. Really, ideally, we're trying to protect as many and in all people as possible, and for folks to identify certain people groups as expendable is just not appropriate whatsoever. There have also been extraordinary anti-Semitism and other bigotry against different religious groups. I have been a part of the Anti-Defamation League webinars over the recent weeks where extraordinarily vitriolic memes and viral videos depicting the virus as created by the Jews or of the Jews. It's very important for us to call that into question, whether it's about Jewish populations, Muslim populations, any religious populations. This is not created. There's actually many different archetypes that are trying to be depicted, and it's important for us to call into question why somebody is posting certain things, or at least not spread that hate any further. And so for us to also identify that different religious minorities are also being impacted by hate online and off. Racism. So there's been there's a lot of news articles and news stories about the impact on people of color in cities, particularly in Chicago and Detroit and New York and so many other cities across the United States, and much higher percentage of those that are either having symptoms, being hospitalized, or dying of the virus from folks of color. And we need to identify the reasons why. Not only is it because cities, of course, have folks living closer together in smaller environments, harder to social distance. That is the case. It's much more expensive for folks to make a living through that with this limited amount of space that they have. But also there has been a series and a system of healthcare that is cumulative against people of color, against populations that either are refused care or are having reduced care or live in areas where care is very hard to come by. We talk about food deserts, so it is the same about healthcare deserts where folks don't have good doctors or nurses or hospitals in their communities in some of these locations. And so it's important for us to identify that for folks of color being disproportionately impacted, it's not just that folks just happenstance, it is a system-wide ism that is at stake here. And even though this isn't noted within the PowerPoint, I wanted to make note also about prison populations, disproportionately Latinx and African-American individuals are making the bulk of the percentage of those that are in our our country's prisons. And so folks to identify that folks of color are also being impacted there, not just in some of our major cities as a result of healthcare concerns. It's also within our prison systems. And the prison industrial complex needs to be overturned. We need to address that once we get past COVID-19. I also wanted to make note there's been a lot of conversation about the term Zoom bomb. By that, for folks that are unfamiliar, and it doesn't have to just be with Zoom, it could be any other video platform, it's the fact that we are living online, working online. All of this access online is causing folks to be able to have more social interactions, and that is a good thing. The negative thing is that when people exploit that, either because somebody posts for their group, their class, what have you, a Zoom login for folks to join, and therefore somebody that comes in as an intruder and either shares these prior references of isms, these anti-Semitic terms, xenophobia, or even from the sexism standpoint, so I've heard and I've seen of folks that have shown pornography or have exposed their genitalia, other things that clearly is harassment, clearly is inappropriate, clearly is another form of sexism and sexual harassment that needs to be addressed. And so with Zoom bombing, it's not just about that one platform, but anybody uses online media and online platforms to be able to harass others. So there are tips. I will share some in a later slide, tips for you to be able to protect, but it is not your fault that somebody tries to exploit the fact that we are online at this time. And last but not least, of many other topics I could discuss is nationalism. So for folks that may be reading the news, the Attorney General recently has, and all others in the administration, has made moves that as we are distracted or really focused in on COVID-19, as we should be, he and others are exploiting that by using the virus as an excuse for closing borders, even though we know that where there has been many different transmission zones, from Europe, from Asia, from other locations, that for folks to be closing borders and for legal immigration, for folks that are getting green cards or folks that have already been resident, they're working toward their citizenship, to be denied access, or for asylum seekers, even though there could be social distancing and PPE use and all these other aspects where we can protect folks. It is another form of nationalism, of trying to block out folks from other countries. It's a form also of xenophobia, true, and racism, true, but specifically I wanted to point in that direction because even though over the last 3 years, this administration has tried to exercise privileges to block folks to have legal immigration and folks that are trying to work through their documentation, is especially so at this time when other chaos is brewing, that we are unfortunately experiencing even further nationalism from this administration. So we need to address that as well. So clearly, if you haven't seen already, there's even more than this. There's been a lot of online hate crimes and bias incidents occurring every day. We need to find ways in which we can counteract that, good speech against hate speech. And so some prevention tips for folks that are using video conferencing software more readily. There are ways to set meeting passwords, to share that information with individuals and right before the meeting rather than in public forums, to be able to have a waiting room and let people in individually or clock out people. If there are folks that do disrupt, to be able to kick them out, record them and kick them out. So there's maximized security there now. There's also with social media settings, making sure you maximize privacy, closed groups, invite-only groups. If people do post things online, reporting them, using the resources that we have online to ensure that folks know what they can and cannot share and do. It's important, and we do this, of course, in residence life and student affairs anyway with our code of conduct, is making sure that we have ground rules for any kind of interactions, but especially now that it's on an online forum for the most part, or video chats, making sure that folks understand what it is that's expected of them. So whether it is about muting themselves, unmuting themselves, whether it is about use of the chat feature, whether it is online social media platforms, if it's a moderated forum, and we'll get to that momentarily. If there are folks that just have some ground rules and expectations, we're not curbing speech, but rather protecting marginalized populations. So it's again important to understand that free speech, hate speech dynamic, that you can put parameters and ground rules and expectations for private groups like this without actually curbing free speech. You can still engage in free and academically free speech. That's important too. So the other tip that I have here for online activities is have others assist you. So whether it's facilitating a meeting, maybe somebody else is taking notes and you're facilitating the dialogue, if you're capable of doing that, if somebody is able to work with the wait room and let people in one by one, or maybe manage subgroups with Zoom and some other platforms, you can actually have subgroup rooms that can be facilitated. Having others assist you is obviously always easier just in general to have more hands-on and more eyes on what's going on. Maybe others are helping if there is a disruption to record issues, to help you compile information. You can also have help with moderating groups, and so it doesn't have to just be on you to be managing online hate. That if indeed you encounter this in online classes, maybe you have a chat feature with your staff members, that if there are issues that come about, hopefully not from staff, but from students, from others, that you're able to have others be a team member and moderate that and address that with you. It's not all on you, it has to be a team effort. And so again, procuring some assistance will be helpful. It's important, and we're well attuned to this within residence life, to document everything, that in incidents online or off, document. And so whether that's copying messages, taking screenshots, if you're not familiar with the tools that you have on your phones or on your computers, to making sure you can know how to take screenshots. For most standard keyboards, the print screen option is there. You can print screen, either post that into a Word document or Google Doc or into Paint and save that as a picture. You can also copy messages or solicit, as I mentioned others, if somebody else is moderating a group, have them copy messages and share that with you, making sure that that snippet can be helped with the investigation later on by the folks that you're submitting the report to. So make sure, if you don't have a biased report protocol already handy, make sure that's developed, of course. But if you do, making sure that you're using the support from your campus police or campus security. If you have other resources, for instance, like me, who would be a bias response officer, or somebody who's a crisis responder on campus that would assist you, maybe your conduct office, using other folks to be able to lean on, making sure that those resources are available as you're submitting reports, gathering the amount of information that you need. You could, and this is something, because we're all online, to use your IT department. They often can be able to track information. Now, some things online are anonymous, as we know. It can be very difficult to track some things, but you'd be surprised surprised how much is digital footprints that your IT department, especially if you're using software or tools that your school is availing yourselves, you can perhaps use that. And submitting bias reports, there's also plenty of other opportunities through social media platforms. They have their own reporting and measures for harassment. So make sure you use those tools accordingly. Even if you can't do something for your online, you can do it for the offline for other companies to be able to assist you. I really want to focus in on the listening piece, the active listening components, particularly for anybody going through trauma. It's essential for you to really hear them and not just hear them for their words, but for everything that is being impacted by any kind of hate or bias or anxiety or issues that are encountered online. And so focusing on that impact, focusing on that individual, give them undivided attention, just as we talk about with folks that are experiencing either gender-based violence, sexual assault, so too with hate bias, to have that trauma-informed response to ensure that they have options, that you're not investigating what's going on for them. You may eventually collect information, but that ultimately at first, the primary indication is that you're trying to be supportive and compassionate for what it is that they need. And so they will share with you certain details. It may be that you ask some very light, broad, open-ended questions with how you can help them. If there are specific options like reporting measures or counseling center, health center, other centers that may be on campus, diversity centers that can help them, then certainly make sure that they have those resources, and maybe even some resources that aren't exclusive to your campus. Maybe there's a crisis hotline you refer them to if they feel like they need to go through that, or other resources that they may encounter you might be able to read upon. The point is that you are focusing in on their individual impact and what is it that they need. And so providing that compassion is important. But by doing that, using thoughtful and inclusive language. And I'm not just referring to pronouns, I'm not just referring to gender-based inclusive language. I think we often focus on that in our work, but really any kind of inclusive language, any terminology, anything about, when we use different language around race or ethnicity, when we use language around ability, making sure, about mental health, that there's importance for us to identify the terms that are best respecting those communities. So making sure that we are inclusive, that we are keeping up to tabs on what is inclusive language, because that continues to change as we modify and advance and progress with how we speak with one another. So again, using that thoughtful, inclusive language will definitely affirm identities of those that you're supporting. After that's important, after the listening, is to connect people to those resources. I'd already mentioned that maybe some of those resources are on campus, maybe there's some that are off. It's important that you're not just doing a handoff, that you're truly checking in with them and seeing what is it that they need. And so very well may mean that at the end of that first conversation you have, or that in an email exchange or Zoom, whatever it might be, that you ask and say, is it okay if I check in with you a couple of days just to see how you're doing? Not to pry information, not to see what it is that they've done or what resources they've accessed. They may share that, but the important thing is that they can feel like there is an ongoing support network in you along with others, and following through with that is very important for them through this situation. But focus on positive action steps. So some of that may be some of the resources, maybe there's a delay or lag in how things might be responded to, especially in this time of age. It might be hard for people to respond as quickly as they might do it in person on campus. Then making sure that those action steps are tangible but flexible, making sure that folks know that they may receive some response, but it may be delayed, and making sure that they know where to turn to if there is a delay, or if somebody doesn't follow up, if it's their supervisor or other offices, etc. I cannot stress enough how much misinformation and disinformation is out there on the internet, and even by our very politicians and administrators in our government. And so it's important for us to call out information, misinformation, with providing good, accurate information. And that may mean that you have to be polite, but also direct in saying, here are certain sources that may need to be vetted further, or other sources. You may have your favorite platform, either online media or a TV show, what have you, that you get your news. It's important for you to really ask the questions. Are there secondary sources to this? Are there valid information? Is this speculative, or is this pronounced factual? Is this data back this up? Data can be used in a variety of ways. Is this comprehensive? Is this, how much of the health industry is really behind this information? Is this something that is just one person as an individual saying this on a more extreme end? And so it's important for you to provide that accurate information as you're sharing with individuals that you're supporting, including yourself. So if you do encounter misinformation, disinformation shared your way, to not pass it along. Just because it gets to you in your social media feed does not mean that it needs to be passed along without vetting. It may sound enticing, but it could be clickbaiting, could be inaccurate information. So the last piece I have here for connecting is making sure that tech companies improve their security reporting and policies. I have a success story out of this specific bullet that Zoom actually did in recent weeks increase their security. They also increased their visibility on how to report, on how to record and kick somebody out of a Zoom meeting. Previous to these situations, unfortunately, there weren't that tools, or the tools weren't as visible. You had to go through settings, and it was kind of a convoluted mess to get to. They received a lot of pressure from folks at the Anti-Defamation League and other groups that said this needs to be improved for folks to be as responsive as possible when they encounter hate online. And so fortunately, they were responsive. They're continuing to improve. It sounds like other companies are following suit. It's important for you to push companies to do that, whether it's through public policy, maybe it's through some resources that you have, could be even just through using the reporting tools yourself and be able to share that with others. If you know that Twitter has a certain reporting measure, making sure that others are familiar with that too if they're asking. So ensure that folks are aware and push them to do better. I would be remiss if I did not include something about us being educators. You know, yes, we're in student affairs, res life, but educators are we also. And so empowering one another, being in solidarity, naming the hate, even calling it just for what it is, gives us the power rather than it the power. So naming what it is, you don't have to give it more life than what it deserves, but calling it for what it is and not spreading that misinformation or that hatred on, but just sharing that this is a concern, here's what we're going to do to combat it. But also increasing your own awareness or those of others about hate speech laws, policies, trends, you know, whether it's from the federal government and the Department of Justice, or maybe it's, as you probably know, over the last few years, last 3 years specifically, hate speech and hate groups have increased. And so identifying those trends, what groups, what symbols, this is my next piece, what symbols or words or images, what gestures, what flags, what other things are being used to spread hate against people groups. And so making sure that we're familiar with what are the origins of Confederate flags, and you know, what are the origins of certain symbols that are used for hate or certain numbers that are used for hate. If we can then identify that and understand it ourselves, it then makes it that much easier for us to share with others why it is a concern when they may be not aware that they share that with somebody else. But the hope is that we breed education against ignorance. And if that ultimately gets too overwhelming, it's important to understand when to unplug. And so while we're connected with all these devices, while it is overwhelming to hear all the news and the numbers and all the hospitalizations and deaths, it is very overwhelming. It's also important for us to take a step back, maybe identify when either listening to the news or engaging on social media or engaging through these Zoom conversations is unhealthy, that we can maybe take a step back and do something that's more for our own benefit. We can log off. I know it may be hard to do that, especially if somebody is really engaging you fervently or saying some really nasty things, but sometimes you just need to walk away from these toxic online conversations. I also included video games. With the prevalence of being online, more and more video games are being played and used, but unfortunately it just also means that more and more hatred. It's the minority of folks that are gamers. I'm a gamer myself, but those minority are unfortunately very vocal and take over chat rooms or take over certain games and video game bomb, if you will, to try and share their own vitriol and misinformation, share their own hatred. So making sure that we address them, but also logging off if we feel like it's not going to be something that we can address ourselves, reporting it when we can, but unplugging is also a healthy outlet at times. And for those that have the privilege of being able to go outside, not everybody does, of course, for a variety of reasons, for weather, for capabilities, for all sorts of things, for their own health. But if you're able to safely go outdoors and get fresh air and sunlight, it's unbelievable how, when it is a sunny day, when you can feel the breeze, how much that can really counteract. Even if it doesn't change everything, the equation of the world and the chaos therein, can allow us to really recalibrate and center ourselves and make sure that we are feeling and sensing more than just the situation at hand, because it is very chaotic and very difficult, but we sometimes need that to just go outside for a moment even if it's cracking a window if you can't walk out, cracking a window and just feeling some of that cool air. So again, campus housing has always been a place where emergency crises, conflicts, and parent complaints, there have been, our days are consistently, even on a good year, challenging, where we address all these crises, conflicts, and issues that come about. But ultimately, in a time like this, where it's a world crisis, it's not just an individual crisis that we're responding to. Yes, we are responding to individuals in said crisis, but we need to be able to live our values as institutions. And so campus housing, whether it's about our communication with one another as a team, communication with our students, communication with those that are interested partners, making sure that our crisis response lives with our values. If we have certain values of inclusion and equity, I hope you do, that those are also embedded within what you do to respond and ensure that everybody is supported. And within that, some of our populations, more and more, we're finding students who either because of the fact for financial reasons, for family reasons, or for potential abuse reasons are homeless, that they're going home either isn't possible or going home would be a very unsafe environment. And so making sure that if we are able to, I understand that some campuses don't have the luxury of doing so, but most campuses could host or hold a few people. And so making sure that those folks can be supported, even if we don't have our dining facilities, at least they have housing and some safety. And also, I know that it's a financial decision that is very difficult for a lot of your CFOs and for folks in senior positions, but if we can reimburse student costs, given that they have not, this is a very disrupted situation over the course of the last several weeks. And yes, it has disrupted our lives, it's disrupted the lives of everybody in our world. But for those students, yes, we're concerned about the costs and the viability of our institutions, but we also have to be concerned about those students who may go into further and further debt without maybe a degree even, or maybe concerned about where, when, or how they might come back, to ensure that they are getting reimbursed for these costs, whether it is about student fees, housing costs. I know it's difficult, and some of you have already made the brave decision to do that up front, but not everybody has been able to. Please consider that. That is something that, in terms of students' interest and honestly also retention, it's harder and harder for them to justify if another school is reimbursing costs, how they would come back to your school if they don't have some costs reimbursed to show that they have not been expending the same kind of resources that others would. And last, but definitely not least, don't forget the live-in staff. For most of you are live-in or live-on that are listening to this presentation, this is actually my message right now is to those that are your supervisors, so those folks that either live off campus, live near campus, what have you. But don't forget the trials and tribulations of when you probably were living on at some point, and the challenges of living where you work. We have to remember, we're not just working from home. I think that that's misunderstood. We are working in the midst of a global pandemic, a global crisis, and we're trying to make it work from our home. And so identifying that for our live-in, live-on staff, that this is their home, this is your home, that focusing on supporting you in the midst of that, whether it's about the self-care, and maybe it's a senior staff member or a mid-level staff member who comes on the campus regularly enough with safety precautions in mind, of course, to address certain issues in the office, but not to expect that the live-in, live-on staff does everything that happens, whether it's about move-outs of property, whether it's about coordinating issues that are going into the summer, fielding parent complaints. It needs to really be on the senior and mid-level staffs to really take in some of that. And having been an SHO before, I know how hard that is. You're getting a lot of pressures from above, but it's essential for our live-in, live-on staff to be supported, and they'll see that. They'll identify when you are helping them out and really sticking yourself out there for them. They will work that much harder as a result. So please make sure you don't forget them. Which leads me very well into managing self-care. I particularly left the heart in there as a graphic because I think we often talk about critical thinking, but we don't think about critical feeling. We don't ideally talk enough about emotional intelligence and the way that we are helping each other as feeling beings and not just thinking beings. And so supporting your own self-care to therefore help others care is absolutely essential. The next piece I talk about has been getting a lot of press lately about teleworking, this productivity myth that folks can work 8-hour days as if they were in the office, not remembering the fact that often in our 8-hour or even more longer 10-hour days, we were breaking it up a bit. We're seeing people, interacting with one another, sometimes taking breaks, sometimes getting some meals. You know, that interaction, that movement back and forth to different things, even just a change in scenery is an entirely different phenomenon than sitting in front of a video conferencing platform or in your email for 8 straight hours and feeling like that's the most productive. Quite frankly, anybody who's an expert in productivity would show that you need to take breaks, you need to have different changes of pace, you need to show that a new change in scenery will actually make you more productive because it allows you to be creative. It allows you to get perspective. And so if folks are pressuring, I know that for a lot of you, either because you're hourly or because your supervisor wants to maintain you in the position, that's wonderful, but you cannot be at 100% 8 hours a day or even longer. It's just not feasible. It's not care for you. And it's not even actually productive for the larger team. It damages morale. And so I really encourage folks, particularly in management positions, to address teleworking and productivity and valuing data differently when it comes to these crises. Kind of countering that is planning some virtual connections. Another way to break up your day is to occasionally in an afternoon or in an evening connect with friends or loved ones or folks in a more informal setting, even if it is colleagues, to ensure that it's not just talking about work. Don't talk shop all the time. It's important to try and create some virtual support. I think one of the misnomers that folks continue to get wrong about this whole situation is that we're not really social distancing, we're physical distancing. And so that physical distance may be between us and many others that we care about, but socially we're still needing to be connected, whether it's by phone, by video chat, by some other means. I've even heard of people doing pen pals just to try and something liven it up and be more creative. And so making sure we're planning those virtual connections, something to look forward to break up the monotony in the same day. As you're doing that, setting boundaries. So wherever you're staying, whether it is fortunate in an apartment or home, or it's in a more temporal environment, to try and set boundaries for yourself, the boundaries of time, setting boundaries with a partner or a loved one that may be staying with you. Maybe it's setting boundaries on timing for when to go to bed, when to wake up, setting a routine, setting boundaries around food and other care. The idea that these boundaries can really affirm your needs and communicating effectively will also affirm you as a long term. Because for a lot of us, this is uncommon for us to be doing this from home or from a place that isn't an office or isn't with our students. And so trying to find a new routine and by setting those boundaries is going to be essential for us. And if those boundaries need to change, we can identify them, but we need to articulate them well. I've mentioned the word privilege a couple of times throughout the presentation, and I'll continue, is that appreciating our privilege is something that we need to do. And so there are times, so for instance, for me to be gainfully employed, to know that right now I am working is a privilege when so many others aren't. I have a place I can stay, I can call my home, is a privilege. I can appreciate that, but I can also support those with less privilege. So those that are struggling financially, maybe struggling with mental health, struggling because their lack of connection, whatever it might be. Even if I have privileges, I can use them for the good. And so it doesn't mean that I deny my privilege or feel guilty about that privilege. It's owning that privilege and therefore helping others as a result. You know, we talked a little about this with the media that we might encounter and disconnecting and unplugging, but really naming the chaos without being captured or consumed by it. You know, whether it is maybe moderating the way you listen to or watch news. You know, for me, somebody who loves the news and kind of continues to be updated on news and read the news regularly, I've had to really cut back. Even though initially I really wanted to be informed on all the different information, I needed to cut back. And so it's important for you, whatever that looks like for you, to name what it is that's chaotic, to name something that is stressing you or bringing you anxiety, but not to be captured or consumed by it, to really allow there to be space where you're not constantly being, because it's just very hard to be in a constant state of chaos, a constant state of trauma. And so making sure you can step away from that when you can. If you can't, making sure that others know that, to be as gentle and sensitive and supportive as they can for you. And I'd mentioned this a little bit already, but we're developing a routine, including some time for hobbies and passion projects. Really what I refer to that for folks that are capable. So for some folks of you that are very creative and doing, you know, great elaborate art pieces or learning a new language or playing guitar for the first time in years or whatever it might be, that is wonderful for you. And I affirm those who want to use their creative outlets to write, to maybe do a video series, to do all these great things that you are longing to do somehow in your spare time, or at least because you're at home, you're able to have access to these things. I want to be also cognizant and point to the contention that not everybody can do that. You know, learning a new language is great, but frankly, there's a lot of folks that aren't going to have the time or the space to do that, or the ability to do that. There's some folks that simply getting up in the morning and getting to a workplace or doing work from home is itself a success, is itself a big win. And so, you know, be cognizant when you are sharing with each other your passion projects, your hobbies you're developing. If you've learned to do a great thing, or you're now doing a 5K running because you're still able to go outside and go running, well, just remember that some people can't run. Some people, if they were to run, you know, there's health challenges therein. There are other folks that may be still having to take care of loved ones at home, and so running would put them away from taking care of their loved ones. Just understand, whatever it might be that you're developing, be cognizant as you share that with each other. You can provide your own self-care without necessarily coming off to other folks as disengaged from their own needs. And so just putting that out there for folks as you try to develop that routine of self-care. So we've heard throughout the course of the last several weeks that this isn't normal and that some folks want to go back to normal. And I would be remiss if I didn't say there is not going to be going back to normal. That isn't good, nor is it possible. There's too many people whose lives have been lost, whose lives have been completely shattered and shaken, either because of loved ones passing away or jobs lost, or, you know, all sorts of things, economic, financial issues, you know, businesses going out of business, that our lives are different and there's not going to be a going back, but we can create a new norm. The way we do that has to be sensitive and acknowledging all of the various broken structures that we have in our midst. So I mentioned some about the prison industrial complex or the various isms that we might encounter. The reality here is that folks with power and privilege, whether it's with finances, whether it's in government or businesses that are sustaining throughout this, they're unfortunately going to be the ones setting the new norm. And so we need to be pushing them with their privileges to be doing that in the most ethical and responsible way possible. And we do that by addressing some of the isms, so fixing these systems. So for instance, a big one is the healthcare industry. We have wonderful nurses and nurse practitioners and doctors, and not even just those that are directly providing care, but those that are providing the medications for those care, the equipment, building, you know, from a manufacturing standpoint, ventilators and PPE. We have a lot of people that are doing that, but the system is broken. The system does not favor, it's more of a sick care rather than healthcare. It's not a system that helps folks in oppressed communities or in cities or folks in marginalized identities. It's important for us to address that, to say, call it for what it is, but also say, here's some alternatives. Here's some things we've learned to be better prepared for the next pandemic. Sad as it might be, we might encounter, we need to be prepared and have a better system in order to do that properly. I want to talk about vulnerability momentarily, just take a side tangent to say, with folks that are in leadership positions, when we're calling into question some of the power and privileges they're in, it's important to react rather than with guilt or with shame or with blaming, to be more saying, as vulnerable as we are, here's how it's also impacting us. So if you're in a leadership position, whether it's just for you leading your own team or your staff or your own family, or you're in a senior housing position or somewhere else, to suggest that vulnerability that cultivates trust. So if you say, here's what I know, here's what we plan to do, here's what we don't know. We're not sure about our financial circumstances and what does that look like for furloughs. I wish that I knew. I would share with you as soon as I find out, but here's what I don't know is this. What I do know is here's what our contingency plan is for bringing students back into the residence halls, if we were to do it in singles or not. These are the kind of things that at least developing some sense of ownership over what is known and unknown and what is still yet to be determined, and getting buy-in, which is my next point, is making sure we're centering those voices, whether it's the student voices, the staff voices of the oppressed. Those folks that are without power are the folks that really need to be the most trusted at this time, especially in the midst of chaos and trauma. We need to make sure that those voices are heard, those voices then implicate and indicate where we move forward, and that creates a new normal that we can be proud of rather than continuing the status quo that we've experienced that got us here in the first place. So what you've seen is kind of a carrying out of this model that I helped create. My supervisor and I worked together along with another colleague of mine that's much better graphic design than I am. But we developed this. It has plenty of links, and certainly if somebody wants this presentation, you can click on those links and use them for yourself. But I wanted to just model for you what it was in my first couple weeks on the job here at College Park. This model that I helped create called the GRACE model that really gets into all the things I've already shared with how to really provide self-care, to respond, to report things, to learn from this, communicate, all these aspects. I want to make sure that this was shared with you as another resource that really is the baseline behind what I've already been working on so far. We did have a few audience questions that I wanted to tackle as a result of soliciting some of the audience feedback in advance for this pre-recorded session. So I'll read it to you aloud and then I'll talk through it. These are very good questions. The first one is, how is this disproportionately impacting those who recovered from addiction? What are ways that we can be unintentionally contributing to that negative impact? Thank you so much for the person who contributed this and the next question. Is wonderful questions that they are. Is a very difficult and nuanced situation. Clearly in a crisis situation as we're in, we need not lose sight of the fact that folks can still be injured, people can still be hurt, can still have health challenges, cancer, other things, even beyond COVID. So COVID, while it's our centerpiece of the conversation at this time, is not the only thing. And specifically for addiction, because it is a disease, not the same disease, but still a disease for drug addiction, for alcohol addiction, for porn addiction, for gambling, for all sorts of addictions, for us to be centering and supporting those folks who are also going through very difficult either withdrawals or who are successfully overcoming it, but challenged because they're same support networks that they used to have. Maybe they probably don't have an AA meeting that they can go to, or if they do, it's online, it's not quite the same. Or if they're trying to reach out to a counselor or a therapist or a social worker, those folks are generally not going to be responding in person anymore. And so for folks to get those resources are very difficult. I should also point out now, it's not really related to addiction, but for folks who are in their homes, this is a high stress environment. And so for folks, there's an increase in child abuse, an increase in sexual violence, domestic violence at this time. For folks, a similar thing, finding crutches and ways for somebody to cope through the stress and through the anxiety and through the pain and trauma, through addiction. Similarly, through a lot of other factors, folks are at home in very volatile situations and feeling like they're losing hope and less resources that I mentioned previously. And so turning to alcohol or drugs or gambling or violence against others are ways for outlets. These are not what we would hope, of course. We want to have healthy opportunities. I mentioned previously about some self-care opportunities, but I do want to say, when it comes to addiction, because it is a disease, we need to treat it as such and try to reinforce with the message I shared earlier about changing systems around healthcare to really be better for folks with addiction, not just here and now during this crisis, but thereafter, making sure that folks that are experiencing these kind of withdrawals and challenges, that they're not looked down upon. They're trying to be supported for what it is that they're going through, and making sure that they have a better situation and have resources, even if it's not something that's in person, something that can still be worthwhile for them to recover long term. So let's continue that conversation, and not contribute to that impact, but let's also identify as a bigger challenge of the healthcare industry on all disease and all viruses and all the challenges that we might encounter. The second question, likewise, very nuanced and challenging, but very good one, is how are economic and gender disparities and stereotypes magnified by childcare during COVID-19, and how can we practice allyship to eliminate these disparities post-COVID? So the first piece, we could divide this out between gender and economic disparities. Is absolutely true that the pressures upon gender roles for folks that identify as women, that they are expected, unfortunately, in our society, based on the way it's been traditionally set up with gender roles, that being the primary health and child care facilitator for their family and for their folks around them. There are far more nurses that are women than men, and that is our world, and there are far more women who identify as mothers who they also take care of their children when perhaps others, either in heterosexual or in gay couples, there may be some challenges for them to be able to take care of their children, either because of financial reasons, maybe they're taking care of another older loved one, or maybe somebody is going out, one of the two, if there is a possibility for one of the two to have a job that they're going to. The challenges therein are far beyond what I could describe in one answer, but gender disparities because of gender variance for me, and also because of the pay gap for folks in these various healthcare, childcare industries already are a challenge or pre-existing challenge. Then it also compounds the economic concerns. If folks aren't getting paid and folks aren't having enough healthcare in advance, then the likelihood that the gender disparities are even exacerbated by this virus even further. And so the more that we can really magnify not the stereotypes, but magnify the problem to address and create solutions so that we can come out of this with a better situation, the better for everybody. And then in terms of practicing allyship, some of that relates to us really on behalf of. So an example could be as if a colleague of yours or supervisor of yours is taking care of loved ones at home as childcare, that you really levy a little bit more support or more of the workload and use your privilege to be able to take care of other things at work on their behalf in conjunction with them, that they're not incapable of working, but perhaps their hours look different because in the midst of when you're having a meeting, they're also trying to take care of a baby or taking care of a kid who needs schooling as well. And so there are fortunately some regulations out there for family leave acts that are helping, but they're certainly not substantial, they're not enough. And so for folks, it's important that allyship is not just through public policy, but individual as well. Individual outreach is important. So make sure that all of the above when it comes to support, that we're using our resources accordingly. Next question was, what can we do to better help our students or staff members struggling through mental health during this time? You know, I mentioned a lot about self-care, but some of this is just starting off with acknowledging that mental health is a challenge for many of our students and staff in the first place, that not only here are some solutions, let's start less with solutions and more with owning that this is a challenge that many of us are facing, and it takes many forms. For some, that isolation is the biggest process and challenge for them, is that they're not able to connect with others in their midst. For others, it is the anxiety around economics and financial stability. For others, it is around disease and having healthcare challenges, and on top of that, mental health. The idea that this is a very layered response in the midst of the crises, that as best we can is reaching out to those students who are letting us know that they're having these issues or needing these resources, giving them the resources appropriately, but not just simply handing off to a counselor or to a healthcare professional, saying, here's some other additional things that may be worthwhile. So we have some links online, we have our staff, we have other resources, rather than just simply suggesting that mental health is a unilateral, you go to a counselor and then it's all better. It's not quite as easy as that. And there's also stereotyping. We need to diminish the taboos around mental health and particularly seeking counseling and therapy. So that would be another way that I would help, is trying to demystify. There are a lot of counselors and therapists that are doing online sessions, are willing to do that via one-on-one on Zoom or on some other video platform. Maybe that's another resource to try and reach out to. Or crisis centers. I volunteer at the Rape Crisis Center, the RAIN National Center, and so folks need to have online connectivity and they need to talk to somebody with counseling background or social work background. There are means for which they can go to online platforms, even if it's not ideal, at least it's better than nothing. Last question I received, what advice would you give senior housing officers or SHOs to help their team through this crisis? I already mentioned about vulnerability and leadership, but I think I'd take it a step further, having been a senior housing officer, the nuances of feeling the pressures from your president or VP alongside your colleagues, alongside the staff that you're supervising, is just, you know, managing not just the vulnerability, but the realistic expectations that you can provide for them, you know, centering their experiences, making sure that while there are a lot of budget considerations and long-term strategic planning, we can talk in circles about all the big things that we may be preparing for the fall or beyond, that we also need to center the voices that are individually reaching out to us. And I would say take the proactive step. Don't wait until a staff member says to us they're experiencing either mental health challenges or, you know, financial challenges or worried about whatever might be happening. Be proactive in your communication. Reach out and share what you know, what you don't know. Share that you're interested in having listening sessions. That can be a really good bridge. And another thing through this crisis is really identifying, here's some things, take a quick notepad or what have you, type some notes, and here's some things that you need to work on. Once this crisis is over, you know that this protocol or this policy or this system that you know that you have influence or control over has to be worked on, and really invite your team to really be a part of that solution. You can invite them now to give you some feedback, but understanding that maybe what's most salient for them is the crisis at hand, and maybe that some of it is you're taking some notes, identify what it is that you can work on for later term, and then thereafter make sure that you come back to it and involve others in the process. Here are a few additional resources. I've mentioned Anti-Defamation League before. There's been a lot of webinars that they've put out. Now that's more specifically for anti-Semitic tropes that have been affected, and they've tried to put some information out there about hate around Jewish populations, but they've also done some around Latinx and Muslim populations and for folks of color. So I do encourage you to check them out. PEN America is all about countering hate speech with free speech, so please check them out. That's another good resource. And Diverse Issues in Higher Education is a pretty global resource for those either working alongside or interested in students of color, staff of varying diverse backgrounds, to ensure that identities are respected and honored. They have their own magazine. They certainly have a lot of webinars that have come out recently and blogs. And so I encourage you, for all three of these resources, check these out and even add to that. There are great resources out there you can share with your team. And so if you want a copy of this presentation, or if you have additional questions that I wasn't able to answer or I need to answer more completely, please contact me. I gave you my own personal email address, brianmedina1@gmail.com. I welcome you to reach out. If you want to reach out just to talk about your situation, I'm happy to set up a Zoom one-on-one, or even just an email if you prefer to connect that way. Or if you want to have some more dialogue and maybe explore some other opportunities or expand upon what I've shared thus far in this presentation, please, I invite the conversation. I want to make sure it's interactive and supportive of you, acknowledging that everybody's needs are different. I'm sharing this in the broader scheme, but I also want to make sure that you have your own individual needs met as well. So thank you. I do want to take a quick moment to appreciate SlidesGo for giving me the format. I looked them up and found the original template that I used for this. I modified it greatly, but a lot of the pictures that you see in red were from SlidesGo, and I just modified a lot of the text and positioning and everything else. So I want to give them credit where it's due, but I wanted you also to have my contact in case you need me any further. I do appreciate you. I hope that during these uncertain times, these unprecedented times, that you're able to take care of you and your loved ones, that you're able to use this resource as a positive for you and your team. But I also just hope for you to be well and be centered. And if you do need, I'm here for you. You're not alone.